Okay, my name is Angela Scott. I'm going to be doing IV insertion today. I'm going to start with my 7 medication rights. Right patient, right medication, right time, right dose, right route, right documentation, and right indication. And the 12 safety practices are verify the client in order, perform hand hygiene um, before and after touching the patient. Going to verify the policies and procedures, um, consult the manufacturer's recommendations, knock on the client's door, identify the client with 2 identifiers, note the overall care of the client, explain the procedure, provide for privacy, don PPE, and raise the bed for good body mechanics. And then lower the bed back down when I'm finished with the procedure. And if there's any abnormal findings, I will report it to the nurse, make sure the patient has their call light, and document. Okay, so now I'm gonna get started. Have my physician orders here coming into Miss Husky's room. Miss Husky, I'm gonna be inserting an IV and also doing a blood draw of CBC and Chem 7 today for you. So I'm perform hand hygiene. I'm gonna put on my gloves and get my stuff together here. Got my Tegaderm that I got my name, initials, date, and time that I'm inserting the IV. Going to get this and place it on, I'm gonna do the right arm of the patient. I'm gonna find a vein, place this, on there. For some reason, I can't even think of what it's called. But I'm gonna place it on, I'm gonna find the vein. So I found a good vein. I'm going to untie this, let it sit. I am going to clean the area for 30 seconds and let it dry. And I'm gonna get my supplies together here. Okay, so the arm is dry. I'm gonna tie this back up. Okay, then I'm going to get my needle, uncap it, look for any shearing, and make sure that it is all intact. Okay, then I'm going to pull the skin and insert the needle in the catheter. I'm gonna look for flashback. I have flashback, so I'm going to withdraw and just hold steady. Then I am going to secure this with a piece of tape. And then I am going to get my tubing and I'm going to attach my tubing. Then I'm gonna get my tubes and I'm gonna do my blood draws, the CBC and the Chem 7. Take those, place them over here for later. Then I'm going to take this up, apply all of my stuff here. Take this off of the patient. Okay. Then I am going to flush the IV, remove this. I'm gonna flush it just to make sure that it's clear and there's no issues with it. Okay, so we're good. Then I will cap it just for cleanliness. Okay, so then I'm going to saline lock, and then going to let the patient know that I'll be back to check on her and make sure she has a call light and all that. So now it's 10 o'clock according to the doctor's orders. I'm coming back into the patient's room. I would have removed my gloves, hand hygiene before I left. Come back, perform hand hygiene, put my gloves back on, let the patient know that we are going to be running normal saline at 125 milliliters per hour. So what I'm going to do is prime my tubing here. I would set my pump to 125 milliliters per hour, and I'm going to uncap this, and I'm going to connect this to the patient's IV here, and make sure my pump is set at 125 milliliters per hour, and let the patient know I'll be back to check on them, just assessing how they are taking the IV and if there's any issues, phlebitis or anything like that. So I would perform hand hygiene, leave the room, then I'm coming back into the room, I'm performing hand hygiene, putting on new gloves, and letting the patient know, Ms. Husky, I'm gonna be administering 2 milligrams of morphine into your IV. So I am going to clamp the saline and take this off. I'm going to remove it momentarily. I'm going to flush with the new flush the IV, make sure everything is flowing appropriately. Remove the saline lock that I would have removed earlier. Flush, then I'm going to get my morphine, and I am going to administer my morphine over 2 minutes. 2 minutes have passed. I've administered the morphine, and I am going to reconnect my normal saline to the patient. Okay. Make sure the patient has their call light, everything that they need, that they're comfortable. Before though, I would have administered the morphine, I would have asked the patient their pain level on a scale of 1 to 10. Then I would come back in 30 minutes and reassess the patient's pain level. And that's it.